pressure is not high enough, or what we call our autonomic system. Our autonomic system is our ability for our body to adapt, doesn't respond quick enough, you could certainly have that. So they always say there's a direct relationship between our autonomic system and the balance system, because we require that fight or flight response to carry out our actions. And so if people don't have that ability to respond to certain stimulation, then their vestibular or their balance system may not allow the blood pressure to react appropriately, and vice versa. So it's a relationship that is directly involved. And so what I mean by that is, we have what's called a baroreflex as part of our autonomic nervous system. And this means that when we're sitting, our blood flow and our blood pressure is going to be quite different than when we stand, right? So when you stand, you have an immediate change in position. Your inner ear senses that change in position. It then tells our blood vessels to contract or dilate to certain parts of your body. And obviously this is an instantaneous response. And so what I'm saying is, if you don't have a good functioning inner ear system, then your blood pressure system may not react appropriately. And then of course, if you have a low blood pressure system, then of course it kind of becomes like this snowball effect where both systems are not working well together. So the next thing to talk about are non-inner ear or non-vestibular causes of dizziness. And like I said, generally this is a blood flow or like a stroke type symptom. So it's important, if somebody has a strong cardiovascular history, in other words, they've had problems with blood pressure or problems with stroke in the past, or heart attacks or blood clots or things like that, it's very important to make sure they're not having a stroke. Now, isolated dizziness, so in other words, no other symptoms, no facial weakness, no numbness, no tingling, no change of their voice or swelling or anything like that. Isolated blood flow causes of dizziness are very, very rare. So less than 1% of the time, it's a stroke, because a stroke typically has other sorts of neurologic problems. The other thing that is huge is polypharmacy, and so many different medications can cause dizziness too. And so it's really, really important to have a discussion with your family practice doctor about trying to get off medications, of course, unless they're absolutely necessary. And so, antidepressants can cause some dizziness. Parkinson medications or different antipsychotics. Beta blockers are blood pressure medications. Calcium channel blockers are also blood pressure medications. Diuretics are also used for blood pressure control. So if many of these medications are used, it could just cause low blood pressure, which people perceive as dizziness. Other medications, anxiolytics, so medications that reduce stress or anxiety, they reduce the whole system, and so that's why they reduce stress. And they work, but they could also cause some dizziness. Muscle relaxers, in a similar kind of fashion, they relax the system, so of course they could cause some drowsiness and confusion. And then interestingly enough, some cholesterol medications can cause dizziness too. It's definitely not very common, but I have had multiple patients say that once they stop their cholesterol medication, their dizziness resolved. So this is something that I kind of just mentioned previously. In a patient who has concerning symptoms for a stroke, they're going to typically have other symptoms, so numbness in the face or limbs, weakness of the face, difficulty swallowing, memory loss, unexplained weight loss, slurred speech, hearing loss that occurs suddenly, double vision. As you can see, all of these other symptoms can represent different neurologic problems that would occur with a stroke, not just an inner ear problem. And so when it comes to the management of dizziness in older individuals, it's very important to have a complete medical evaluation. So I don't like seeing patients for dizziness unless they've been evaluated by their family practice doctor, because we need to rule out blood pressure problems, diabetes, thyroid problems, different types of neuropathy and things like that. And of course, seeing their eye doctor, having an eye exam. And so again, all of these things can play a role in our balance system. So it's important to make sure all of those systems are functioning and intact and doing well prior to seeing their ENT doctor. And so once we've come to a diagnosis, the majority of the time it's rehabilitation. And we have physical therapy for everything nowadays, and it's great because physical therapy really takes care of most conditions. Certainly, surgery is extremely rare for balance problems, particularly in the elderly. And most of this is carried out with physical therapy. So general physical therapy is typically for orthopedic or muscle and bone type problems. Like you would do typical physical therapy after a knee replacement or hip replacement or things like that. And then just general exercise therapy. So going to silver sneakers, just doing general type of balance exercises and things like that can all be helpful. But vestibular physical therapy is very, very specific. So I always tell patients it's not like typical physical therapy. You're not doing, you're not doing strengthening. You're not doing range of motion. You're not doing stretching. It's a neural type of physical therapy. And so we're training the nerves that are coming from your ears into your eyes, and of course incorporating it into your balance system. So it's a lot of head motion type exercises and eye tracking and things like that to get the visual and the inner ear system working well together. So the other thing that's very important when it comes to dizziness is environmental and lifestyle. So I always emphasize what we call optimization of brain function. So it's very, very important that people are getting routine and regular sleep. They are, eating well, eating good, healthy, clean foods. Avoiding salt is a really big problem with the balance system, or I should say too much salt is a problem. Not drinking enough water. The inner ear is a very, very small fluid-filled system, and it's very sensitive to fluid and salt balance. And so people who either eat too much salt, or don't drink enough water, or drink too much diuretic type drinks like caffeinated beverages can have a large impact on the balance system. The other thing that's really important is stress. And so believe it or not, there are actually stress receptors of the inner ear. Now they're supposed to be there because, like I mentioned, we have this fight or flight system. And so as we respond, we want our balance system to be stimulated. However, chronic stress can also put too much strain on the balance system. And unfortunately, you get this feedback cycle where our balance system is basically being overworked and overstressed. And so when it is expected to respond, it can't. And so stress reduction is very, very important for a functioning balance system. And then there are some things that are environmental even. So allergies, there are allergy receptors of the inner ear. And so that is why sometimes antihistamine or over-the-counter allergy medications can actually help with dizziness, because it could be allergic stimulated. And so if allergy medications don't help, you can do things what's called immunotherapy, or doing allergy treatments so your body can develop a tolerance to these allergens. And then let's see, so stress, sleep, and then just general exercise. So again, keeping those muscles strong, keeping that awareness, that sensation, and all those things. So it's really, really important that we also talk about fall risk. So, having a poor balance system could certainly contribute to significant complications. We certainly, don't want to have these conditions develop, and if we can prevent them from happening by incorporating good, strong balance systems, people will live longer, healthier lives. And so, it becomes again, kind of like a rolling snowball effect. When you're injured, you're at more risk for mobility restrictions. You lose your independence. You become confined in nursing home and facilities. And so, preventing falls and enhancing balance systems can have a big impact on these things. And so I emphasize it's very, very important to make your home a safe place. And so if you have staircases, you should make sure you have a handrail. Always make sure the floor is clean. No rugs on the floor, certainly no clothes on the floor. Make sure there are no loose cords or things that you could potentially trip on. Make sure your bathroom is safe, so handrails in the bathroom, non-slip surfaces, things like that. You can't have enough light, particularly night lights at nighttime, because we have a decline in our vision as we age. We become visually dependent, and your balance system shouldn't be dependent on your visual system. And so having more light will help us to improve our balance system and prevent falls. And then, of course, general clutter. And like I mentioned, just staying healthy, making sure we're not on too medications, getting regular vision checks, exercising regularly, and making sure that you have good shoes with good traction, as well as improving your diet. So when I mentioned that vestibular therapy, the rehabilitation role in treating a patient with dizziness is fundamental to the individual components of our balance system. And so those components, and this might get a little wordy here, but I mentioned the important relationship between your eyes and your inner ear. So that's called the vestibulo-ocular reflex. So vestibular is inner ear, and of course ocular is eye. And again, these exercises help that nervous system to adapt to change. And so a lot of these exercises are with head and eye motion. So you can see like VOR1. This patient moves their head side to side while keeping their eyes fixed on a target. Or the head and the hand are holding the target. So in other words, like this. And these seem like really simple exercises, but they really do have a large impact on a patient's balance system. And then a habituation exercise means that you do an exercise that you don't necessarily feel comfortable with, but you don't do it to a point that makes it unsafe. So you basically keep doing it more and more and more until you get to a point where you feel comfortable with it. So you keep repeating the exposure to this provoking stimulus until you can tolerate that motion. And then a substitution exercise means that you block certain sensory inputs and emphasize the one. So you improve one channel of sensory input. So you particularly focus on vision, or particularly focus on somatosensory, or your proprioception, your touch. So you challenge the proprioception system. The perfect example of this is closing your eyes while balancing. So you can stand on one leg, you can stand on two legs, you could even stand on an uneven surface to make it more challenging. And so you can do all these different components to progress their rehabilitation process. And then the last thing is optokinetic stimulation. And this means that, well, I should say that some people have a lot of sensitivity to a lot of visual activity. So some people get really uncomfortable when they go in busy supermarkets or out in public, or sometimes even driving down the road with all that visual stimulation. And so this helps to desensitize people who are too sensitive to that motion, particularly in their periphery, they can't focus. And so an example of this is having the patient sitting and spin like an umbrella in front of them while they look at the center of it. So they see that peripheral motion, and they're able to strengthen their focus of that particular sensation. There are some novel things that are happening with treatment of vestibular conditions. They're starting to use virtual reality. They're also improving shoes and soles, and so there's something called balance enhancing soles, which increase that proprioception, that feeling of your feet touching the ground. And more people are getting active. They're doing yoga and Tai Chi, and again, we're using novel here as air quotes, but Tai Chi's been around for centuries. But it's a great exercise opportunity for patients to improve their balance system. You can see many places, many families are purchasing video game systems like the Nintendo Wii. There are all sorts of games that can be done where you're standing and you're interacting with the game system. And then, of course, the most important thing to emphasize is that it's very much a team effort. So like I said, we have multiple disciplines, we have multiple specialties who are involved with the balance system. We're working with the eye doctor and maybe your neurologist, a family doctor, and ENT, and physical therapist, and dietitian, and social workers and things like that. So again, anywhere you can get the help, certainly the more the merrier, and the team effort can make everybody healthier and have a more balanced system. So that is the end of the PowerPoint. Let's open things up for questions.
Wow, that's a wealth of information. Thank you so much. I learned some things I didn't even know. So this was incredible. Let me check here. Lori has a question. Does an infection in the mastoid processes affect balance and or hearing or tinnitus?
So it can. It all depends on how significant the infection is. So if it's just a little bit of fluid, sometimes people will get a CT scan of some sort, and the radiologist will say, well, there's fluid in the mastoid, and generally speaking, it's just an incidental finding. A little bit of fluid in the mastoid is not going to cause any problems. Now, if there's a lot and or it's infected, it will certainly have an impact on your hearing, which causes ringing or tinnitus, and then it could have an impact on your balance system. People that get ear infections, the balance system is affected, not because it's necessarily an inner ear problem, but because the middle ear is filled with fluid, and it can indirectly impact the function of the inner ear.
Unfortunately, I can't see everyone, so Kathy or Cindy, can you help me? Do you see anyone having a hand raised up? Unfortunately, I only see 6 people on my screen. Ray, okay, I see one. Ray?
Yes, I have a question related to one of your comments. Excuse me. You indicated that blood pressure may play a role in dizziness. And I'm wondering, are you aware of any highly specific and local blood pressure measurements that can be made? Say the difference between pressure in say the inner ear and the forearm could be significant. And I don't think I've ever had a test other than say limbic or the pressure in the arm, the leg. Can you speak to that?
Yeah, so we definitely don't have the technology to measure particular pressures of the inner ear. There are some tests that can be done measuring the pressure of the inner ear fluid. There's something called an ECOG test, but it doesn't provide a whole lot of information. So I don't typically order that test. Now there are imaging studies that can be done, such as an MRI, that can show the blood vessels, but it doesn't necessarily show the blood flow to the inner ear. Now there are some advances in technology in the research level of things. There's always improving technology, but specifically as far as blood pressure goes, I always recommend just checking it regularly, for one, which you can do at home on your own. But secondarily, it's also important to have your blood pressure checked in different positions. So laying down, sitting, standing, and things like that. And so there is something that a cardiologist can do. It's called a tilt table test, and that's where they check your blood pressure in different positions and to see how it responds to that. And so some people have what I mentioned previously, something called orthostatic hypotension, which means sitting still, their blood pressure might be fine. But as soon as you go from sitting to standing, it doesn't react appropriately, and it stays low when it should increase. So, general medical blood pressure testing, I think, is important, and we just don't have the technology yet to check the blood flow of the inner ear. But it's getting there. So we have some medications that are created to increase the blood flow to the inner ear, and they seem to be working. So we'll probably know here in a little while.
I do have another question. And you also mentioned about high salt levels or low salt levels. So this would be an electrolyte imbalance. What's the time frame for changing that electrolyte balance? And has that balance been actually measured?
So I can just speak for what patients say. Most patients say the next day they usually notice symptoms. So the most classic situation is the Friday fish fry. People will go out Friday night, have their fried fish, and then on Saturday they feel miserable. So I think it's like a 12 to 24 hour kind of thing. As far as measuring the imbalance goes, getting into the inner ear is invasive. So we don't have any tests to measure the inner ear electrolyte numbers. Of course, we do have the ability to measure your electrolyte values in your blood, but it doesn't have a necessarily direct correlation with those electrolytes of your inner ear. The challenge with the inner ear electrolyte levels is it's often just a trial and error. Patients really have to, or some just keep a journal, and some just kind of figure out what works best for them. So again, I think that's something that's probably in the future that we'll be able to test. But right now, it's trying different lifestyle changes and trying different medications if the lifestyle changes don't work.
Would that fish fry phenomenon be reproducible?
Yeah, that's exactly what most patients say. They'll go weeks and weeks and weeks without having symptoms. They'll have a cheat day or whatever you want to call it, or a Friday fish fry, and then they'll go another 6 weeks and they'll say, well, maybe that was a fluke thing. Let's try it again. And well, sure enough, they have their cheat day and they have their symptoms the next day. And again, this doesn't necessarily apply to everybody. It just applies to those people who are sensitive to those salts, and it's very real. A lot of migraine patients express this. I know lots of people who have eliminated salt from their diet and have completely cured their migraines. And it's very similar to an inner ear condition called Meniere's disease that is also very sensitive to salt.
Thank you.
And I think one of the challenges with this is it's also a lot of personal belief. I don't want to say it's necessarily placebo, but the way I always say is, if elimination of salt reduces your symptoms and we don't really have any good way of proving it, what does it matter? If you feel better, then keep doing what you're doing.
I believe Cindy had her hand up. Cindy?
Paula just raised a similar question. I was wondering if you could share information that you have, how tinnitus fits into all of this. I'm hearing more and more people complaining about tinnitus.
So tinnitus or tinnitus or ring in the ear, all the same. The most common cause, of course, is a hearing loss. And so generally what happens is when your ear has a hearing loss, it doesn't send as much information to your brain. However, the information that's going from your brain to your ear doesn't change. So it's basically your brain talking to your ear. And so the most common cause of this is a hearing loss. And I always mention that unfortunately there's no cure for this. However, there's a lot that we can do about it. So, of course, if your hearing loss is enough that it bothers you, then hearing aids will be helpful. Hearing aids provide increased sound input. They also have the ability to do something called masking, which means they put sound into your ear even in quiet situations, and people love that feature of their hearing aid. And the last thing is something that's more of a chronic process. It's called neuroplasticity. And what that means is as your brain is receiving this sound, it then adapts to the way that, in a way that your brain used to be, and it kind of calms down and doesn't send as much of that signal out. Now, it probably won't go away completely, and it does take a year or two for this to happen, but that neuroplasticity process occurs in the brain, which allows it to calm down. Now, there are other things that can cause ringing too. So the second most common is something called somatic tinnitus. And what this means is there's something in your head and neck that is abnormal that could be causing this. So again, The most common thing is something called TMJD, or temporal mandibular joint dysfunction, where people have arthritis of their jaw joint, or grinding, or it's popping and clicking. That's a really common cause of tinnitus. Chronic headaches or migraines can cause it. Neck pain, even some dental issues can cause it as well. So really anything that's happening in the head and neck that is disruptive or painful can cause an exacerbation of your tinnitus as well.
Okay, Paula, it kind of relates a little bit with what you were saying. Her question is, are any of the balance issues you discussed directly correlated with tinnitus, or do they sometimes occur together for other reasons or causes? And I think you may have covered some of that.
Yeah, absolutely. Like I mentioned, the fluid system that's in the balance system is the same that is in your inner ear. And so there are some conditions that have that relationship, particularly Meniere's, is a condition where you have hearing loss, vertigo, and tinnitus, as well as ear fullness. Vestibular migraine is also a condition that has ringing in the ear as well as balance systems. And then, of course, if people have a hearing loss, then that tinnitus will increase as well.
Doctor, I got a question for you. You mentioned the BPV, years ago when I first learned about that, they would say, they would, turn my head very suddenly to adjust that crystal in the back of the head. Where does that crystal come from? How did it even get there in the first place?
So there are two organs of your inner ear. One is called the utricle, and one is called the saccule. And
Okay.
the best way of thinking about it is like different layers. So on this top layer of that organ are these little crystals, and these little crystals are made of calcium, and they basically sit on a layer of gel underneath it. And so when you move your body, those crystals act like a weight, okay? And in that gel are nerve endings, okay? So you have these crystals sitting here, and you have the nerve endings, and when those crystals move, those nerve endings sense that motion, okay? And so that's their functional purpose. However, sometimes those little crystals can fall off of that layer.
Oh, okay.
And so when they fall off into the wrong place, and then they stimulate the other organ that shouldn't be stimulated. And so
it's always back there.
Right.
Right.
They're just in the wrong place. And so this can occur from head trauma. We see this a lot after a concussion, right? We also see this after somebody's had an inner ear problem, because those nerves hold those crystals in place. And if you have weakness of that nerve, those crystals don't have the strength to stay in place, because it's that neural attraction that holds them. And so after an inner ear problem, they can fall out. So oftentimes we see this benign position vertigo after somebody's had like a vestibular neuritis or labyrinthitis, and it's just a secondary effect. And then because they're made of calcium, we also see a relationship. Again, this is a relationship, not perfect cause and effect, but people with vitamin D deficiency are also more likely to have benign positional vertigo. So we always recommend, calcium supplementation in women and in elderly patients, and certainly in vitamin D replacement as well.
Thank you. Let's see here. Okay, so I'm looking in the chat box. I don't see any more questions unless I'm just not seeing it, because I am using my phone, by the way. I'm sorry. Paula said, are there any treatments to reduce crystals?
Yeah, so the most common is called the Epley maneuver, and there are many, many other types of what's called canal repositioning techniques or procedures. And the Epley maneuver fixes about 80% of people. And so we perform the Epley maneuver in our office. There are also a couple other maneuvers that we perform. One is the Samant, and one is the barbecue roll for if the canal, if a different canal is affected. But generally speaking, yes, the Epley maneuver is a found on YouTube. You know, if you want to learn how to do that, you're not going to hurt anything by doing that. The only thing, you know, you might not get better if you're not doing it perfectly correct, because it is really important to do it perfectly correct. And then if the Epley maneuver doesn't work, which again is actually pretty rare, the physical therapists have a whole toolbox of different techniques for those tricky ones, or the sticky ones.
Okay. Do we have other questions for Doctor? No? Okay. Let me double check here. Okay. It is.
Miss Tipton has a question.
Oh, sorry. Go ahead. Go ahead. Louise, did you have a question?
I don't think she can figure out how to get the mute off.
Oh.
Can you manually control her microphone?
I know Ella can, but I'm on my phone. I can't see her.
Oh,
Unfortunately.
I didn't know if the
Yeah, just
the
Louise,
person.
just tap it. Just tap it. Tap your microphone. It will unmute.
Or if she can see the chat.
I might have a question.
Okay, one moment. It looks like she put it in the chat box.
Oh, okay.
Who typically does the Epley?
I'll reply here. ENT doctor, audiology, or physical therapy.
Okay. Thank you. Kitty?
I wanted to ask the doctor where he's located. Maybe I could go to him and he could tell me what other doctors to follow up with. He could diagnose all my problems.
Doctor, do you have affiliations in Indiana?
Oh, yeah. I don't know anyone personally, but there are a couple things that you could do. So I'll put this in the chat. So vestibular.org is a website that is a national website where you can provide do a search there to find local providers.
Okay.
That I would say is probably your best resource for any balance problems and looking for a local balance therapist.
I have one last question.
Yeah.
With regard to, I know Meniere's you can't fix. No one can fix that. But these other medical problems or issues, some of these, I guess, can be remedied through exercises, like you said, therapy. But throughout a person's lifetime, do they ever really get rid of these things altogether, or is it just something that keeps coming and going, depending on their lifestyle? Is that a fair statement? Is it a fair statement, rather?
So there are various things. So there are cures for Meniere's specifically. Unfortunately, the hearing usually doesn't come back. Once the vertigo stops, unfortunately, the hearing is usually gone. But nonetheless, the vertigo does eventually stop. The average span of a Meniere's patient is about 7 years, but that's very specifically Meniere's. But for other balance conditions, There are certainly optimistic outcomes. Some people do have to make lifestyle changes. Maybe they can't do things that would put them at risk, such as climbing ladders or being on the roof or things like that. But I think generally speaking, there's always a very positive outcome. Um, People may not be able to do what they could do decades prior, but they still should be able to have a good quality of life in some way. Making adjustments basically.
Yeah. Okay. Okay, any other questions? No? Oh, Julie has a question. She says, does core exercises help?
Oh, core exercises? Yeah, absolutely. Because it all plays a role into that balanced system, right? So we can't have a good balanced system without each component of that system being strong and functional. So your core strength is what stabilizes your body, and so it will absolutely have an impact. I always encourage patients to not only just exercise regularly, but also do things that are a little bit challenging to them. Every day challenge your balance system. There's a really great book. It's by Carol Clement. It's called Balance for Life.
Oh,
I'm not sure if I'm getting her name spelled correctly, but this is a book that gives patients an idea of how to incorporate balance into their daily life. So, little examples like when you brush your teeth in the morning, stand on your left foot. When you brush your teeth in the evening, stand on your right foot. When you're doing this, do that. Just little things throughout the day that you can do to challenge yourself.
thank you. Ella also has a question. She says, can you get over the sensitivity to seasickness?
Yeah, Chris has got this one.
Yeah.
That's tough. That's really tough.
Stay off the boat.
You can take medications, before you get on the boat. But I've never been able to tolerate being on a boat. Since I was a kid. So I honestly don't think so. Besides just taking a lot of medications before you get on the boat, but unfortunately a lot of those medications make you sleepy, so it's probably not going to be as enjoyable. Um, I would never say never. Maybe with a habituation type process with a physical therapist, you may get some improvement. But again, like I said, I've struggled my whole life, so it just might be something innate.
Ella, are you there?
I am, but
Oh,
I
there she
also
is.
have a house full of guests. I'm so sorry.
Okay.
But boning works, correct?
Boning?
Yeah, that works. That works for some people, like similar to like a Dramamine.
Mhm.
Yeah, and like I said, maybe that's all you need is just a little bit of medication. And yeah, absolutely. It's like if it doesn't make you sleepy and it works for you, then totally support that.
I think there must be a genetic component because when you ship animals on boats, there's always a certain fixed percentage that get seasick and the others don't, like sheep.
Yeah, that's very interesting. You know what else is funny? I did my fellowship in Seattle where so many people live on boats, right? So they're fishers and so, and they would actually get land sick. They do not like being on land at all. They
Oh, wow.
they just want to get back on the boat as soon as possible.
Yeah, it is funny because such a different lifestyle. Paula says, Paula, hold on, let me read that again. Did seasickness draw you to this profession?
No, it's just coincidence, I guess. I think what drew me to the profession, well, there's a lot of things. So from a hearing standpoint, I think it's pretty awesome to restore somebody's hearing once they've lost it. That's exciting. There's the anatomy of the inner ear is fascinating. You're working under a microscope, and we're talking less than millimeters. Can make a difference in somebody's outcome. The second component is the balance in the vestibular system, of course. And I'll be honest with you, I wouldn't actually say that I developed a strong passion for the balance system until I got out in practice. And I just realized that there's so many people that struggle with this, and unfortunately a lot of doctors just don't enjoy it. And so for me, I kind of enjoy the challenge, and I would say it's not exactly something that I signed up for, but I just feel like somebody has to help all these people, and I guess I just enjoy doing it now. But I definitely didn't see myself doing this, for sure. Yeah.
Chris, what is your question?
What is the difference between a DO and other medical doctors? So when it comes to general medical doctors, with a license to prescribe medications and do surgery, there are only two types. So, MD and a DO both have very, very similar educational courses. The DO, or the osteopathic profession, certainly started as a primarily family practice oriented medical profession, and with that they learn something called osteopathic techniques. And what they do, and what we learn during our school, is emphasizing musculoskeletal treatment options to help with medical conditions. So, our musculoskeletal and our organ systems are directly related. And when you have dysfunctional organ systems, it can manifest as different muscular problems. And so we learn in our school to, in a way, it's very similar to chiropractic type techniques. And so that's like the best comparison that I could think of. But we learned a lot of those type techniques in school, in addition to all of the medical problems. Now, obviously, the profession is developing, and so I think historically there's a primary focus on primary care as well as this osteopathic technique. But as the years go by, more and more DOs become subspecialized and pursue fellowships and so on and so forth. And I hope that a lot of those original techniques and thoughts don't go away, because I think that is really important. But generally speaking, in the end, it's basically the same. The DO programs are certainly starting to do more and more academics, more and more research, which is similar to the MD profession. So that's kind of a long-winded answer, but in short, in the end, there's really not much of a difference, but the foundations are a little bit different.
I think Don had a question.
I have a simple solution for the seasickness problem. Be drafted into the Navy, be put on a destroyer, and head for Australia. I was seasick for a month and a half, carried a bucket with me at all times. After a month and a half, I got an ironclad constitution. Unfortunately, after you're on shore for about a year, you lose that and you start over again.
Thank you, Don. Quite interesting. Any other questions or comments? No? Okay, well, we want to thank you so much for your time and this valuable information that you provided us. We certainly learned quite a bit today. And we have our certificate of appreciation coming your way. And also, our treasurer will be sending out a gift card on our behalf for you. And we want to thank you so much, Dr. Prueter, for your time and education. We appreciate it so much.
Yeah, I appreciate doing it. Happy to help.
Have a very happy Easter. And for all of
Yeah.
you out there, enjoy your time and enjoy the weather. It looks pretty nice out there today. Thank you all for joining us. We appreciate that as well.
All right. Thanks, everyone. Have a great weekend.
You too. Thank you. You too.